But the US is really interesting now in the digital health space, which is what I'm mostly kind of concerned with.
Okay.
I mean, you're seeing all sorts of really interesting signals pointing towards a sort of, I believe, a sort of inflection point that's going to happen within the next 5-10 years.
And what's that inflection that you're referring
That
to?
inflection point is going to be a mass expansion of integrated health technology that is decentralized from the hospitals. So being able to monitor, collect data, and treat people from the homes or wherever they are. Right now, I would argue that it is almost archaic for people to go to the hospital in the case that they don't necessarily need to, considering we have such amazing tech these days. I mean, we have self-driving cars and mobile phones that are recording this podcast and putting people on the moon with reusable rockets. It's like, why can't we monitor people's health conditions passively and immersively, you know?
Right.
A lot of the times, especially in the healthcare world, it's quite confusing because they use the word decentralized in two ways.
Okay.
The first way is geographically decentralizing.
Right.
So something like decentralized clinical trials, it's a buzzword, DCTs.
Yep.
That is essentially explaining moving the sensors and the treatment geographically to the home away from the hospital. Okay. It's not talking about the databases. Whereas a lot of people, when they hear decentralizing, they think, oh, blockchain or some sort of like, technology that distributes data. That's not what I'm talking about here. I'm talking about the decentralization in the context of geography.
Okay.
But the decentralization in terms of data is also a very interesting point. Should there actually be a centralized version of data where there's a primary holder of somebody's data, or should each individual patient have access to their own data through a distributed blockchain network somehow, which they then can give the key to different parties of interest, right? So that's a question, that's a big loaded question, but yeah, the first thing that I was kind of bringing up was the idea of sort of patient monitoring, at-home diagnostics, at-home treatments, hence the Coolmate development, right? So delivering biologics at home, monitoring biologic distribution at home, controlling that whole sort of supply chain and that user interaction at the front, like sort of front-facing level. That's something that I think we're really going to see kind of being introduced in the markets very quickly, very soon. I mean, you can look at all like the sort of major suppliers, even insurance companies. I think it was Highmark who recently came out with a statement that they're now shifting their policy to support digital therapeutics in anticipation of what I think of the FDA sort of reclassifying what they think is a medical software as a medical product. So currently, right now, you can't use a digital therapeutic to augment your biopharmaceutical therapy and get extensions for, let's say, IP, right? But that may be shifting, right? Maybe changing. And so you're seeing all these signals in the market saying, hey, we're now going to support this, even though it's not widely adopted. We're shifting, we're preparing, right? You're seeing all these signals and it's like, what is that telling me, right? And the macro trends all kind of point to that same message that, yes, we're going to have some sort of decentralized way of managing data, not necessarily storing it. I don't know the answer to that yet, but I do know that people are going to be much more efficiently managed to the point where they don't necessarily always need to go to the hospital, or where what I like to call, it was a philosophy that was born very early at my time at TTP. I used to call it ambient diagnostics. This idea that healthcare or diagnostics is an ambient and passive immersive experience, something that's almost like magical, right? But then I redefine it from ambient diagnostics to ambient healthcare, because ambient diagnostics is a little bit too constraining in its definition. Ambient healthcare, in my eyes, is a vision of the future of the world where hospitals almost become obsolete. So a world where healthcare is just kind of happening in the background, something that just kind of...
I think that's going to be very scary for many people.
It may be,
right?
But change is uncomfortable, right?
Right.
And I also think that a lot of the times when you think of that future, I mean, that's very far out. A lot of people will, their minds will right away go to, oh, I'm being monitored, or oh, is that ethical, or what if something happens? But that change is going to happen so slowly and in such a controlled way that the jumps won't happen fast enough to introduce significant risk, right? So it's interesting. Like the first question that you asked me at the beginning of the interview was, how do you deal with the ethical considerations? Everybody's thinking about that,
right?
And that's what's preventing that jump, right?
Right.
And I think that's good. I think that's healthy, and I think that's responsible, right? But at a place where we're trying to push innovation, we have to imagine what the future is going to look like a million years from now and work our way back.
Okay, right? I'm going to ask you two questions, and I don't want to forget them, so I'm going to put them out there.
Sure.
Tackle them as you wish. What are the most exciting areas of innovation in healthcare? So everything from robotics to AI to genomics.
Genomics, yeah.
You name it. What are the things that get you most excited about and you want to see happen? And how are those comparing to what you're actually seeing in the world in terms of uptake?
So the most exciting versus what's realistic. Yeah. So I'll give you an example of what's really exciting. We've talked about it a lot at TTP. The idea of digital twins.
Oh yes.
I think Alice maybe have talked to you about that. Yeah. So it's essentially the idea that you could model a person or model a drugs interaction before you administer it, right? And then basically run a probability or run a simulation of what would be the best course of action to treat a specific disease state, right? And to a certain extent, I mean, you could draw parallels from a lot of pharmacological methodologies. So there's actually some really innovative things happening in Dubai where if you have a specific type of cancer, they'll take a biopsy of that cancer. It's a very expensive procedure, but they will take a biopsy of that cancer and then distribute it to basically all known chemo and all known medication types.
Right, I heard about that.
Right, and then they'll see which one is the best responder. Instead of doing it actually in you, they'll kind of run a simulation, right, and then give it to you, and it almost works every time.
I'm almost curious how much that costs.
Too much. Yes. But the idea is to basically do that in a software-based world rather than in the real world, because it cuts costs down and you can scale it.
And like any innovation, the initial product is like costs an arm and a leg, and then it eventually becomes more affordable.
Exactly. So yeah, the idea of simulating and digital twins and sort of predicting outcomes is really, I think, at the main driver behind all technological innovation in healthcare, right? Yes. We want to know things are going to happen before they happen. Right. And even if patients don't want to know that, we can act on it, or we can know about it to make their treatment in a reactive way better. So coming back to the ethical thing, in this world that I'm imagining, or TTP is imagining, where everything is holistic and passive, you're going to run into the situation where people may not want to know that they have something, right? Because would you want to know if you have cancer, or would you want to know? That's tough, right? So,
and also the other issue, and I don't want to make you forget your point, is that if I know my probabilities, like what does 30% mean? Like what does that actually mean? It means nothing to me, because I could be within the 30%, I could be within the 70%. It's the luck of the draw.
Yeah.
Is it or is it not? And I understand the concept of statistics, but there are some challenges there of what you do with that data, and also how will that then be imposed on you?
Exactly.
Because will you continue to be the main decision maker, or will there be other parties saying, well, no, 100%. You can't just decide for yourself, or society that pays for your healthcare?
Yes. And that's kind of wrapping in so many of the themes that we talked about, right? The things that, like the decision support stuff that I was talking to you about. How do you communicate a complex output from an algorithm to a patient or a clinician? Like, how do you even communicate that? When are they ready to receive that information, right? How do they act on it? Are they ready to act on it? And then you also have to understand, which I haven't gotten my head around, is if you're giving people all this information that could perhaps be scary, are you taking away their autonomy? Are you taking away, because, like if you say, if you don't do this by this day, you're going to develop this, right? All of a sudden, I don't have free will to act on what I want to do because I have new information, right? So there's a whole ethical world you can go down, right? A whole ethical spiral. But I really do think that, I think any level-headed person that wants to better society, it's going to come down to, can we predict something being successful or not when it comes to healing or preventing something, right? That's what medicine really is, right? And I mean, even if you look at the sort of market trends, like there's a huge shift going from reactive care to preventative precision medicine, right?
Finally.
It's happening. And a lot of even the client work that we're doing with some of our pharma partners, a lot of it is centered around patient monitoring and trying to predict clinical outcomes before they happen, right? Wow. And that really excites me, because it's right in line with my thesis about this idea that the world is going to go in that direction, right? And we're seeing money being spent on that from those R&D sectors, and that gets me, thrilled. That gets me hyped up, right? So yeah, to your point, what is the most exciting thing? The most exciting thing is being able to model outcomes before they happen, even if they're very, very complex, something as complex as the human body or even the human brain, which we're very far from doing. But then on a note of what's feasible or what's being adopted, coming back to some of our client work is, yes, patient monitoring at the home, or what's really interesting is a good place to innovate is where you have high-risk patients already. So sometimes it's very hard to justify monitoring or innovating in areas where people are already healthy, right, unless you're dealing with like insurance models or something a bit more crafty.
Right.
It's very economically and also socially beneficial to innovate in areas where people already have ailments, or if they've just been diagnosed with diabetes, or if they've just been diagnosed with early onset of something, where you can then streamline the preventative care or streamline reactive care ongoing.
Right.
And that is really where a lot of our work is being focused right now. Yeah.
And that's, I think, that gets me thinking about the Neuralink.
Yeah.
Right. Yeah. It's being used and sort of been tested on people that really, really need it.
Yes. Yes. I think clinical trials are like starting in 6 months or something now.
It's insane.
Yeah. So who knows? I mean, Elon's a crazy guy. But
he's a crazy guy, but he's followed through with most of the things that he's followed through, whether they're successful or not. With a few things that worked out pretty well. So we'll see what happens there.
Yeah, it's also a field that really excites us. At TTP, we do a lot of like deep brain stimulation work. I don't know how much I can say on it, but yes, it's a lot of sort of implantables, looking at actually delivering therapies through implantables from the home. So software-based therapies by literally zapping neurons and fixing things as you go.
Way too intense to even think about.
And like preventing things like seizures or even modulating therapies as their symptoms change, right?
So I can see that in pediatric population to be something so huge.
Yes. So it's interesting. The pediatric sector is actually an area that I've been really interested in this concept or this idea of patient monitoring or healthcare sort of distribution at home. Because, I mean, look at it from a practical standpoint. How many parents out there have kids and, their child, which can't even speak for the first however many years of their life, right, is crying or doing some abnormal behavior and they don't know what the heck's going on, right? Imagine if you could understand the human in a way that is non-invasive. So you have this ambient healthcare model, like a smart baby crib or something, right? Where you can, understand if there's a significant health risk, something that doesn't touch them. A lot of the technologies that we've been looking into is like oculomotor tracking, so like eye tracking, movement tracking. A lot of the times, actually, there's some really interesting research coming out showing that you can very reliably predict a lot of neurocognitive deficits at an early age, like autism, just based on eye movements. So you can break down a baby's attention and extrapolate that and compare it to the environmental stimuli. And if there's certain inconsistencies, you can start to flag them for things that are likely. And it really cuts down your, misdiagnosis for things that could be treated early and change their life for the better at a very young age, right? So things like autism, for example, if you catch it early enough and you deploy behavioral sort of therapy techniques, you can really, really progress that person in a different way if they weren't otherwise diagnosed.
Very related to this and kind of in the same sort of breath. I'm thinking here, mental health issues, depression, bipolar, schizophrenia, suicidal ideation. I mean, how much more relevant could it get, right? This concept of ambient healthcare.
Yeah. And actually, another really interesting area I've been researching too, and we've actually explored this heavily with our clinical network. That point that I talked about earlier, communicating how the digital tools for patients are going to vastly outpace the digital adoption capacity for clinicians, right? So clinicians won't be able to use all these solutions that the patients are willing to use, right? That is going to be a big problem, probably in health, in mental health first. Because with mental health, there's a lot of digital applications that are now being shown to really provide clinical outcomes, right? So things like cognitive behavioral techniques that can be deployed on your phone, alerts, push notifications that can help you kind of get over your humps or understand how you're feeling, feed forward that information to the clinicians. Because mental health is very information-based and environmentally based, it's something that's easily integrated or more easily integrated, right?
And that takes me to my next question. Or should I not interrupt? Did you mean to finish that?
Yeah, well, the point that I was going to get to was that's all great. But the biggest barrier that we're now seeing is the clinicians. It's not the patients, right? So in this idea of this ambient healthcare world, how do we allow clinicians to better adopt these technologies? And some of the things that TTP has been internally developing, I'm actually leading this project, is using basically machine learning models to understand complex behaviors and complex interactions through vocal biomarkers, through conversations, through the way that the clinician interacts with their computer, bringing together all that information and actually, how do I say it, extrapolating meaningful insights, presenting that to the clinician to cut down on their time when interacting with those digital tools for patients.
Okay.
Right.
Question's twofold. Mm-hmm. One way, how do we encourage or promote for healthcare providers to adopt technology? But at the same time, my thought is that when it is adoptable and it's really seamless, organic, and it solves a real problem, people will pick it up without you having to convince them. I'll just give the example of your typical Apple phone. Nobody needed convincing. I mean, you took it in your hand and you used it a couple of times, and then you just didn't want to go back to anything else. The question for you is that we're creating solutions for the patient or for the healthcare provider or for both. And then, or can it be for either or and both at the same time?
Can it be for either or both at the same time? Yeah, good question.
Almost like a user sort of like specific, yet all the data is integrated.
So I think it depends on the use case. Let's take an example of a wellness app or something that's not heavily regulated, something where somebody wants to, monitor their mood. Maybe they're a little bit worried about their mood or they're worried about their physical activity. I mean, we're already seeing mass adoption just from the consumer level where the clinician doesn't get involved in things like smartwatches, et cetera, right? So that's kind of the one side of the coin. The more interesting side of the coin that's very difficult to solve is that whole sort of healthcare integration, which I think is what you were getting at, is at what point do you have to develop solutions that serve both versus just the patient and the clinician, right? I would probably approach that to say any good patient solution incorporates the clinician, because at the end of the day, like, the clinician is the mastermind behind serving that patient and making the prescription calls and understanding what course of treatment they're going to go through. And technology, whether we like it or not, is never going to replace a clinician, right?
That was my next question, actually.
Yeah, it's never going to happen. The only thing that will happen is the clinician's role will slowly change over time by interacting with those tools, right? You need to have that personal understanding of what a human is, right?
Why though? Because I'm saying, so there's currently models, and this is totally being the devil's advocate. You think about it now, we're replacing humans with AI generated models where AI can speak, interpret human emotions, and be able to respond in relation to that.
Might even be better than us.
Exactly, because you don't need them. I mean, the training is there. You just put a different face to it. It's not, there's no turnover. There's no, all the factors associated with human labor, obviously. But aside from that, the diagnosing will be done largely by AI. I would
passively
say.
I think it all boils down to now we're getting down into philosophy here.
Yes.
It's going to boil down to whether or not we can, with confidence, define and reproduce consciousness to the level to which we think we exhibit it. And the reason why I say that is because if you look at the history of time, I mean, even in the Industrial Revolution, people thought that manufacturing was going to take over all the jobs. It wasn't going to be anything, right? So if you just extrapolate on that time frame, I think it's human nature to use tools and then apply it to our human experience, right? And mostly because up until this point, and perhaps artificial intelligence might be able to empathize and experience emotion, but that's a big if. And even if they do become sentient, if you want to argue that, the fact that there's no reliable way to measure consciousness or define it or prove it, I think you will always need that translation from machine to human experience.
Oh, okay, that's a great point, actually. I really like that point, actually. I really do.
So the roles are going to change, but as they always have. but I don't think anybody should be scared about the world is going to be taken over by robots or whatever. We might be living with them in a symbiotic community, whatever you want to call it, but we are a human species experiencing human reality, and that will always exist, right?
Right.
And I used to think, there was a part of me that used to think maybe one day it will happen. But the more I've kind of learned about the industry, and I mean, even just human nature in general, like, I don't know if you ever read the book Sapiens.
I've heard of it. No,
yeah, it's a really famous book. It basically outlines like the human history in the snapshot of like one novel. It talks about like tribalism and how even crazy things like violence has really driven us forward, and how humans, how a currency was invented, and technology, like what really is it? And actually, we had a really interesting thread at TTP a couple months back, and it was a really good representation of how TTP thinks. We got a random email on a Friday afternoon, and a notable figure sent it company-wide, and they said, what do you guys think technology is, and where do you think it comes from, right? And we were just having a sort of email thread discussion on this, and it kind of resonated some of the things we're talking about right now. Okay. The answer that I kind of reflected on was, technology is a reflection of human consciousness, human experience. So, like, for example, to a bird or an animal, yes, they won't really understand the utility of a car, because that is so far removed from their perception of reality.
And I agree with you, yet I'm still concerned that it's a real possibility the AI could be a real threat to
Maybe.
us. I mean, we cannot continue without doing anything to improve our existence. If we really think about it, this is obviously, again, a philosophical point, but if you think about it across time, we have significantly improved the opportunities to a richer and better life, I think. And maybe not, life is not better for everybody, but if you think about lifespan and just opportunities 50 years ago versus 100 years ago to today, it is significantly better for a larger number of people than it ever has.
Yeah, exactly. And coming back to the sort of machine learning talk that we had, one point that I think is really important to note is, as much as I'm excited about machine learning and the way to which it can be dynamically applied to pretty much any sort of problem, what you see is that it's much more economically efficient to actually apply machine learning models to specific siloed problems rather than a holistic application. So I believe, I think a lot of people would agree with me, is that we're really far away from actually realizing a holistic artificial intelligence system that is able to encompass the entire medical system and serve people like a doctor would. It's economically beneficial and really justifiable to say, let's develop an algorithm that can predict this, right, and then a doctor will use it and use their other tools alongside that. So to combine that all together is I think, very far away. And once we get to that bridge and cross that, I think we would have a much better handle on what our roles are going to be, and the healthcare system entirely will be probably totally reinvented, and this conversation probably would be outdated, right? Put it in a time capsule.
That's right. Yes. Yeah. No, but it is absolutely interesting, and I think it's crucial, because nothing is more important than health, right? It's life. So that's why I'm excited to be in the field. And so I might ask you, aside from health, what other area is very interesting to you?
Let me think. Well, I think I touched upon it a little bit, the autonomous vehicle sector.
Yes, yeah.
I do believe in autonomy. A lot of people fight it. I think that autonomy is healthy for humankind.
Okay.
I think the reason why I think that is because it's going to relieve us of jobs that treat humans basically like machines, right? It will allow us to explore the more human elements of us, which are things like creativity, socializing, networking, ideating, imagining new things, innovating. Let's automate the things that are boring, and let's enjoy life a bit more, right? Not to say that hard work isn't good, and we have to appreciate all the work that's been done, and it's been in the history of humankind. I mean, if you kind of want to take a step back, like, yes, there's been a big journey, but as we automate things, it does objectively improve our lives, like you said, right? Like, People would say, oh, we're taking away jobs from people that need those jobs and so forth. But personally, I believe that shift is going to happen in a way that is friendly to the supply chain, right?
Yep.
Like these things don't happen overnight. They happen as the demands of society and populations change, and technology realizes things slowly. Yes, technology innovation happens fast, but the deployment and the sort of widespread adoption doesn't happen as fast as people think, because people are hard to change. And fundamentally, that's the biggest issue we have in healthcare. Right. It's an oil tanker of a machine. It's hard to change.
Yeah.
And as much as innovation excites me, the other thing that excites me is trying to solve those problems of change, right?
I think we got a good sense of what TTP is,
yeah.
And it was a really interesting conversation. But I wanted to ask you a few more personal questions.
Sure.
Your favorite vacationing spot and why?
The first place that pops in my mind, and I mean, typical Anthony would be like, I want to go somewhere warm. I want to be at the beach. And I mean, I have a bias. I'm Croatian. I would love to be on the Croatian beaches again. But a place that I've always really wanted to go to, and I mean, we have clients there, but I've never been there yet for work, is Japan.
Oh,
yeah. I'm fascinated with the culture there. I'm really fascinated by the way that the city is set up and the infrastructure, and like the way that people socialize. And actually at TTP, we have a couple of my colleagues who lived in Japan for a couple of years, and they've told me all about it, and it's exactly kind of what I hoped it would be.
Yeah, no, I mean, that for me, I want to see Dubai too.
Dubai, yeah.
Yeah, I really do. And so the next one question, if you are at home, you're relaxing and you want to watch a really good movie,
oh my gosh,
what's your favorite movie of all times, and what would you watch?
I'm the worst person to answer this, because I can't sit and watch a movie.
No?
I don't even have a TV in my house. I find satisfaction and utility in creating things rather than interacting with things. Does that make sense?
Yes.
Yeah.
Yes.
But I will give you some of my favorite movies, because I have watched movies.
Okay.
I'm a human being.
You don't have to, but if you do
no, and it's something I've actually been trying to work on it. Like,
okay.
my mom, speaking on my mom, she's always like, Anthony, you have to learn how to relax, And so a couple of my favorite movies, I mean, you'd probably be able to guess them. One that comes to mind is The Matrix.
I love that one too.
Yeah,
I mean, mostly everybody does.
Yeah. The Matrix is amazing. Things like Limitless.
Oh my God! Okay,
Limitless is
that
good.
movie was insane. I really like. Have you watched Avatar? I know that.
I have. I've watched the new one. Yeah.
You watched the new one?
I watched the new one.
Oh my gosh! And what did you think?
I'm a big Avatar fan.
Finally, what's your favorite car? So if you could buy your favorite car tomorrow, what would it be? And if it's not a car, then what would you spend a ton load of money on if you had unlimited resources?
Yeah. Well, I'm biased because I actually own shares in this company.
Okay.
But it's a manufacturer in China called NIO, and they've been, I guess, branded as like the Tesla of China, and they're a very sort of innovation-focused autonomous vehicle manufacturer. And they developed this supercar called the EP9, and it's pretty much one of the fastest cars in the world right now.
Wow.
It's like a supercar, and it's entirely electric. And I think they beat one of the records on I can't remember what track it was. It was in Germany, like the loops going around. I don't know. I remember all of it. But it's a stunning car. The technology is amazing. And they just released a new car called the ET5, which I would probably also buy if I could have that. It's an insanely intelligent vehicle. And I just think the technology that's packed into that car would just blow me away if I could actually experience it. They're supposed to be moving to the North American markets this year. So if they do, I'm hoping to cop one of those models. Nice. But yeah, up until now, we've never been able to have access to it. So, yeah.
So why do you think it's so much better than Tesla or different?
Well, I didn't say it was better than Tesla.
No, okay.
Yeah.
It is a contender, though, you think?
Yes, for sure. Yeah.
Okay.
They're not actually in direct competition. Tesla's kind of slowly transitioning to mass market vehicles, whereas NIO is more of a premium segment car. So they're competing against companies like BMW and Mercedes and stuff.
So right? The design is probably going to address the question of design, because a lot of people find, my husband, for instance, always says,
yes.
Tesla has that feeling of a cheap sort of interior.
It's very engineering
focused. It's too plain. All the digits.
Engineering. It's very Elon-y, It's very engineering, very autonomous based, minimalistic. The thing that I really like about NIO is they have all the tech, but they have such a design focus, which as a designer I can appreciate. And they've come up with this concept called the Neo EVE. I encourage you guys to look it up. Like, it's so cool. They've literally they have this vision where a car is going to be like a mobile living room, right? So it's like seats facing each other. The car is like aware of the social interactions that are happening, and it like supports the ecosystem. And it's like this whole like dynamic experience. It's like an extension of your house. It's like the way that they're thinking about autonomy is, I just think, so ahead of other manufacturers. And although they haven't scaled yet, they're like, I mean, they're doing so many cool things. Like, for example, they're the only manufacturing company in the world that is actually scaling up what's called battery swap. So instead of charging your car, you go into these like little battery swapping stations that swaps out the battery in 2 minutes, right? And you don't even have to get out of your car. And so you can imagine you're going on like a road trip, or like, you know, even in the case if you really want to put yourself out there where you don't own a car and it's just like a hive mind of cars and you just summon one, right? You could just have these cars like constantly going, and they would go in, swap, and keep going.
Like an Uber, but
yeah, it would just be like a hive of cars that are all like interconnected. And I'm sure Tesla shares those same visions, right? But I just think the way that they're deploying it in the context of their design is head over heels of anybody else.
Very cool.
And I would like to experience that firsthand, even though they're very early stages. So, but yeah, like I've been tracking that company for a while, so I'm probably very biased. You know.
I'm curious to find out about it, so yeah. I'm going to look it up for sure as well.
Yeah, check it out.
And so I hear you're going to US. You're off to spend some time in San Francisco.
I fly out this Thursday. I think that's like in 2 days or something.
Oh wow! Yeah.
So yeah, San Francisco. Haven't been there in a while. I'm really excited to like meet all my buddies there. And last time I went, we like created a really good community over the music and everything.
Very awesome. So this is more of a personal sort of.
Yeah, it's more of a personal, but I probably will be taking some other meetings in conjunction, even though it's technically a vacation time or whatever. But it's like I said, right? Like, work is like play for me.
Exactly. So, it's part of your life. It's autonomous. It's the environment, ambient.
Exactly. Yeah. So like,
it is true.
Even some of the guys that I'm meeting up with there at the studio, like some of them work for Stripe and stuff. And the Stripe, I don't know if you know them. They're like the sort of backend provider for all transactions, like across globally.
Yeah.
And he was telling me about like the philosophies of currency and stuff. And like, I don't know, like just having those conversations are so cool. And you would never have them if you were like, let's set up a meeting and like talk.
That's
you know what
right.
I mean? Like,
yes.
Just want to like have a beer, kick back, make some music, and talk about cool things, you know?
This is the beauty of this conversation. I've learned so much from you within like this time frame that I would probably never have learned, or not for a while, if we didn't sit together. So I think sometimes in this format, sometimes in a format of just meeting old friends that you know have interesting things going on, sometimes running into people randomly and being open. And I think that's very important, to be open.
Exactly.
And just really, I find a lot of people get really in a knot about social interaction because we're all very focused on ourselves. Like, what am I going to say? How am I coming across? And if you are able to shed that and really focus on the interaction and the conversation, there's such magic that comes out of that. So I really enjoyed talking to you.
Yeah, likewise. Yeah.
Awesome. And I hope that we can connect again if you come to Toronto, if I'd
love that.
happen to be
I'm always around.
Again.
I'm always around.
That's my final question, I guess. I've heard people call themselves, well, I'm the rainmaker, right? Like if you meet somebody that's really successful with sales, or I'm a creator for someone that's, let's say, software development or engineer, or I'm a nurturer. I've heard somebody that's really caring and develops teams. Some people like to define themselves as leaders. I define myself as an explorer. I'm at heart an explorer. So, and not in the colonial sense, but rather, I don't mind the rocky boat. I don't mind the uncertain weather. Just like you, I love to go out there in the chaos and find patterns. And I think I find it stressful, but then it's also thrilling. So I'm an explorer. You are a...
What am I? Interesting question. Well, the thing that you just kind of touched upon again is going out into the chaos and finding patterns. I really gravitate to that idea, and I think it's one of the fundamentally like most human things you could do, because our brain essentially is just a pattern recognition machine, right? And when you recognize patterns and extrapolate into predictions, that is pretty much what I do all day at a in my strategy role at TTP. And so I guess at the heart of who I am, I would say, I mean, it sounds like a big word, but a visionary. I would say.
I like that.
Yeah, I like to think about and imagine what's going to come next. And those visions usually come to me very clearly. And I think that's why I've sort of fell into the role that I am at TTP in the context of strategy and design and leading the digital efforts. Yeah.
Very cool.
Yeah.
Very cool. So I'll keep in touch because I want to know what those visions are.
Sure, yeah.
So I can jump on board.
You gotta get an NDA signed for that one.
Yes, fine. Okay, whatever. We'll have to read it first.
Yeah.
It was a great pleasure.
Awesome.
I thank you so much.
Thank you.
And, I really look forward to keeping in touch and
Amazing.
hopefully making a lot more of these podcasts and interesting conversations.
Likewise.